just putting on my sanitary gloves here. Have a seat, yes. Okay. And what is your name? Okay. And your appointment was for? Okay. Give me just 1 minute. Okay, so you said your name was, last name. Okay. And your appointment time, okay, yes. Perfect. That's right. Okay, welcome. Well, this is going to be a first for you. Have you ever seen a dermatologist? Oh, okay, great. Okay. So, we are just going to be going over for this first initial visit any skin concerns you have. So essentially I want you to tell me a little bit about yourself as I write some things down about you, okay? Okay, great. Now, so how long have you been experiencing your skin issues, would you say? Okay. And so they started, alright. Okay, I'm just going to be asking you some basic questions and I will be looking at your skin a little bit, okay? Okay, great. Okay, so what is the most troubling aspect, would you say, about this skin problem you have? Okay. Yes, don't worry. I mean, we all go through it. Skin issues are the most common thing. You can imagine how much skin we're covered in. We're bound to get issues, okay? Now, do you see this problem only on your face or is it other areas of your body? Okay, okay. Mainly though, yeah, okay. Now, would you say that you have more oily skin, dry skin, combination skin? Okay. Perfect. Well, to be honest, you do look quite young. Your skin actually does look fantastic. So I wouldn't ever call this mature skin. I would say you have a youthful complexion. Very youthful, yeah. Now, do you spend a lot of time in the sun? Okay. So how many hours per day would you say on average? Okay, how many hours during the summertime would you say? Okay. It would range, okay. And in the winter, do you find that you do manage to get some sun at all, or not so much? Okay. Not so much. So mainly you are getting the majority of your sun in the summertime, as most of us are. Do you use sunscreen? Okay. An SPF of? When you remember to put it on, okay. Alright. Do you wear things to cover your face, like hats, glasses? Alright. Okay. Interesting, very interesting. Okay, so you do have some sun damage you'd like me to take a look at. I definitely will make a note of that. Now, as for your main problem, okay, so you do have some breakouts, okay? Breakouts. Yes. Oh, yeah. I'm way past the age where I thought I would be breaking out, and I still am, believe it or not. Yeah. It happens to the best of us, okay? Alright, so breakouts. And which area of your face would you say you get breakouts the most? Would you say that it is? Oh, okay. Oh, interesting. So you get them there too, okay. Well, yeah, this area tends to be hormonal. And to be honest, this area tends to be intestinal. So, yeah, your bathroom habits are actually important. Okay. Do you mind if I ask you, if it's not too personal, how many times do you go? Number 2 per day? Okay. If you're lucky. Okay. Yeah. This is what I suspected. Yeah. It's really important to get some fiber in your diet to clear up that area for sure. Yeah, that's usually an indication. And now we did mention wearing hats in the summertime. Do you find that you're wearing things like that in the wintertime? Yeah, okay. Alright, yes, because often if your hats are dirty and things like that, it can also cause breakouts. Okay. well, my favorite area, I said that this was hormonal, but often now, due to wearing masks, maskne, it's a thing. It is a thing. Okay, so the breakouts from there. Do you find that you're using the disposable masks, or are you using the ones that you have to wash? Okay, okay. Alright. Yeah, I also use masks that you have to wash, and I often find that I'm very lazy in washing them. That's all. Yeah, I'll get it all here. Exactly. Okay. Okay. So you can, on average, if you find that your disposable masks are around, it is a good idea to use those from time to time. But of course, in caring for the environment, it's much better to use those ones that you have to wash. If washing them after each use is unrealistic, I do recommend washing them after every 2 to 3 uses, okay? Okay. You'd be surprised, especially if you're wearing that mask for hours at a time. Yeah, how much buildup can get under there. I personally, if I'm ever wearing makeup, that's when I break out the most. So usually a clean complexion, just clean skin under there. So if you do, yeah, okay, perfect. I would recommend that for sure. Great, so we're covering maskne. Okay. Now, do you ever get the occasional breakout here as well? From time to time, okay. Now, do you find that you press your phone to this area of your face or the other area? Can I see? Okay, yeah. It makes sense because our phones often have a lot of dirt and bacteria on them. We're touching them more than we're talking on them. So the occasion that we are talking on them, yeah, for sure that can happen. So I'm going to write that down. So I do recommend, if you're going to be having lengthy conversations, to either clean your phone so you can just disinfect the screen with rubbing alcohol and a cotton pad, yeah. Exactly. Or you can just invest in just the earbuds. Okay, yeah. It's not convenient when we're out, I know, but okay. Okay, so your main acne issues are there. And would you say that you get more like cystic or nodule or blackheads or whiteheads? Okay. Okay, so a few near your nose area. Blackheads near the nose area. We can take a look at that for sure. Okay. Yeah, okay. Also there? Okay, yes. Whiteheads there too, okay. In terms of your body, are you okay? Your main concern is your face? Alright, perfect. With body, the occasional one is perfectly normal, of course. Yes, okay. And oftentimes, harsh perfumes or chemicals from like perfume deodorants can really, they have an effect on us for sure. So we don't have to take a look at your body, just your face today. Okay, now, are you noticing any signs of premature aging that you'd like me to look at as well? A little bit near the eyes, okay? Eye area. And laugh lines, okay? Oh no, that's perfectly fine, yes. I love to see someone aging naturally, I really do. There's a beauty in it for sure. We're all so quick to cover up our surprise lines, our smile lines, laugh lines, but often I feel like that's what gives someone character. I would not recommend Botox or anything for you. No, Botox. Definitely not. You look wonderful. Just a good moisturizing regimen, I would say, should be fine for now. You're still quite young, yeah? You don't need it. No. I love a look of a natural face. I really do. I think it's beautiful. Don't need any of that whatsoever. Any other aging concerns? Okay. Okay, so you do, with your combination skin, have some oily and dry, you're saying. Okay. Perfectly normal. And you said that you had a little spot for me to take a look at. A little mole? More like a beauty mark? Okay, for sure. Where is it exactly? Okay. Okay. Left side. Near the nose area. Okay. is right there. Perfect, perfect. So we're just going to go over some acne, skin, blemishes, and a little bit of the... Okay. Well, I already have my gloves on, so I'm pretty much ready to go. Yes, okay. So your skin is clean today. I can see it's quite clean. I'm just going to put this down. Okay, now we are going to be having a look at your skin, okay? Do you mind if I just clean a patch of your skin anyhow? Just to remove any dirt and oil, just to take a look at your natural naked skin. Okay, thank you. Give me a moment to get that, alright? Okay. Okay, so I just have a simple makeup remover. Not that you have any on your skin, it's quite clean, but yeah, I do want to just move any. Yes, and I have this sponge here as well. Okay, so I'm just going to apply this, and this sponge is going to get very soft and very supple. Yes, you can see. You can see that. Exactly. It's nice and soft in the middle, so I'm just going to soften the sponge. Let it get nice and soft, and this is going to basically remove anything we need to remove, okay? Okay. I just don't want to rub your face with our sponge, so let's get this nice and soft. This is natural, so yeah, some clients are actually allergic to cotton, believe it or not, so I like to use this natural sponge. It's far more effective, yeah. Okay, this is soft, so I'm just going to go. What side do you prefer? Okay, I'm just going to go in and just remove a little patch, okay? Perfect. Right. Okay, right there. Do you mind if I... Okay, thank you. Just going to do above. Okay, right in there. Perfect, okay. Yeah, would you also like me to clean the area near your nose? Okay, I'm going to get that area near your nose. You said this is where your beauty mark was, okay. Do you mind if I also just rub near your eyes so we can take a look at that? Okay, so just look up for me. You don't have to close your eyes. I'm just going to exactly just rub right near your eye, okay. I think I'm going to need a little bit more because your eye area is so delicate, and I don't want to irritate it in any way. So let's get this sponge nice and moistened for your eye area. It's really important to use brush remover. Yes. Okay, this shouldn't be irritating at all. Okay. Perfect. See how much softer that is? Yeah, much softer. Spongy. Yes, okay. So, if I could just clean just right near your eye area. Just going to do the perimeter of this side of your face, okay? Yeah. So we'll keep this side untouched, but we'll focus mainly on this side, alright? Okay. Perfect, perfect. Okay. If I can clean around your mouth area too, because you mentioned the smile lines, just want to take a look. And if you can just look up for surprise for me. Okay, I'm just going to clean just right here, your surprise lines and this area. Okay. Perfect, perfect. Touch on your nose area, just going to be wiping that off, okay? And I will be wiping off a little bit on your chin, okay? Just wiping off a little bit on your chin area. Okay. Anything under the neck area that you'd like me to? Okay. Just a touch. Yeah, that could also be hormonal for sure. Okay, we'll have a look. If you could just look up. Okay. I'm just going to rub right there. Okay. Right? It's pretty much, yes. Exactly. Okay, so with clean hands, do you mind if I go in and just poke around there? Okay. Yeah, nothing will hurt at all. I just want to touch this area. Okay. If you can smile for me, actually, yeah. Okay. What a nice smile you have. Lovely. I see those lines and they're nothing to be concerned about. This is actually perfectly fine for your age. Did you say your age? Okay, yeah. Exactly. It's perfectly fine for your age. You actually do look younger. So I wouldn't worry about having any of that kind of procedure done. It's not necessary for you. No, 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 no. No. Okay. Now you said you were having some acne, just a little bit right there, blemishes. Does it hurt when I touch this area? Okay. How about there? Okay. It feels a little inflamed. Some inflammation going on in your body. Okay. Can I just pat? Yes. I'm just gonna touch your chin area. Okay. If you could just look up, I just want to look underneath. Okay. Interesting. That's actually, yeah, exactly as you described it. Okay. And you said you noticed some sun damage, mainly your nose area. Upper lip? Cheeks. Okay, let's take a look at your lip. Okay. Your nose. I'm just going to poke around there. Okay. And you also noticed on your cheek, right there. Can you just close one eye for me, please? I just want to examine your eyelid. Alright. That's perfectly, yeah, normal. A little bit, yes. That's your combination skin, I bet you. Little oily, little dry. Where do you see dry patches? Near your mouth area. Can I just examine it? It's always on this side. Okay, can I just take a look? Yes, it's dry. And you said your nose is more oily. Can I just... Yes, it is a little bit. Okay. Interesting, yes. A little bit here, okay? You're saying that it's both dry and oily. Alright. That's perfectly fine. No worries at all. Oh yeah, this can all be fixed. For sure. Wonderful, wonderful. Okay, so I'm liking what I'm seeing so far. Yes, I will. I will use a tool and I will perform an extraction if you'd like. Okay? On your forehead. Okay. It is quite tender. It does look ready. I can perform an extraction. Okay, I think I'm going to use some numbing cream first, and then I will use my tool. Is that alright? Okay. Alright. Okay, so because it does look a little bit inflamed, I do have a numbing cream here. Yeah, I would like to place a numbing cream first. Yes, just in case. Yeah, this will kick in about 30 seconds to a minute, okay? So I'm just going to apply a small amount on here. There we go. Okay, perfect. Alright, and you said just right on your forehead, okay? Right there. Just going to apply that right at the top. Okay, just tapping it in. Tapping in the numbing cream, yeah, to the dirt a little bit, okay? Sorry about that. Just going to tap that in, okay? Give that a few minutes to settle in, alright? Any other issues you wanted me to address while we're waiting for that? Okay. Yes, near your nose? Okay, let's take a look. Okay, so you're saying that you had a new beauty mark of sorts near your nose. Okay. Okay, so I have a light here. I'm just going to shine it on your nose and just take a quick look at this, okay? And if we need to scrape something off for sample. Okay, let's take a look first. Yep, turn right there, okay. Just going to see. Alright. Can I just touch it? Okay. And this has been how long? Okay, yeah. You noticed it over the summertime. Can I just see? Okay. That's nothing to be worried No. It's a beauty mark, yeah. It happens actually due to sun exposure, so you do have to be careful about it and monitor it for any changes. So if it does start to look irregular or anything, just please come back to me and we can take a closer look, but it's just a beauty mark. It's actually still quite small. Yeah, exactly. Better safe than sorry. I completely agree. It's really good to examine your skin. Okay, so let's test that numbing cream. How's that working? Okay, you don't feel that? Great. Okay, so I have this tool here. We are going to be performing an extraction with this end of the tool at first. So I'm just going to be pressing on there until we do remove it, okay? Okay. And how does that feel? Okay. Nothing perfect, okay. Just pressing on there. And I'm just going to apply a little bit more pressure. Okay. Yes, that is done. Okay. Great. I'm going to actually be disinfecting that for you. Yes. Okay, so I do have some rubbing alcohol. Yes. Just going to apply some on this cotton pad. Okay. I'm just going to dab it with rubbing alcohol. Sorry, did I say cotton pad? I meant Q-tip. Yes, okay, so we are disinfecting that. Okay, so now with a fresh Q-tip, and I have this acne gel, a solution. I believe your skin would react well to benzoyl peroxide, but you can actually use salicylic acid if you feel like that would be better for you, okay? Yeah, so let's get this. Yep, it's just in this small little tube. I use this quite often for clients. I find this to be the most effective, so I'm just going to get a nice bit on here. And do you mind if I just... Okay, I'm just going to pat it in the spot where we performed our extraction, okay? Just dabbing it right in there, okay? So, okay, just right there. Perfect. Alright, it actually looks quite nice. It's not bleeding or anything. I think it was just ready. Okay. Alright. Anything else we can do for you today? Okay. Yeah? Oh, for sure, for sure. We can do that 100%, yes. Okay, so I am going to just put away my tools here. And then I'm just going to wipe off the excess with my sponge. Okay. It looks actually really good. Looks wonderful. Yes. Okay, I'm just going to remove my gloves now that we're done. Yes. I'm so used to wearing gloves, it's like second nature. Sometimes I forget that I'm wearing them. Yeah. Okay. I know. If only masks were the same. If only they were similar. Okay, now I'm just going to write out my skin analysis for you, okay? Yes, the acne is manageable. I can prescribe to you that. Okay. And do you have insurance that covers this? Alright. Okay, so I can definitely prescribe you that, but you can also go to your local drugstore, pharmacy, and just pick things up over the counter. Actually works just as fine, but I used benzoyl peroxide, 5%. Okay, also as well. Cleaned with the solution. Just like that. No need for any further procedures done. Okay, in terms of your skin, I do recommend that you do just avoid sun exposure on your face especially, but if it's not possible, recommend wearing a hat. There are certain SPFs you can use, but I don't recommend necessarily going over a 30. That would be redundant, so yes, but yeah, your best bet is just to avoid the sun if that's the case. You can focus on just applying SPF on those certain, like your nose. Yes, exactly. Perfect. Okay. Don't forget your ears as well. Okay, for the sun. Now for your eyes, I can just recommend to you a great moisturizer that you can use. Yeah, you just have to keep your skin hydrated. Believe it or not, combination skin, sometimes you don't feel like putting oils or creams near your already oily areas, but actually the dryness causes you to produce more oil, believe it or not. Skin is so magical, actually. I'm just going to prescribe that to you. But it looks really good. Everything seems to be fine. So you have an acne cream for your acne, moisturizer, SPF I can recommend you one, but avoiding sun exposure is fine, although this time of year we don't see much sun, do we, these days, so you're actually okay. So the skin extraction is of course on the house, of course. This appointment is completely free. No need to worry. Alrighty. Okay, so how are you feeling? Yeah, probably better knowing that your nose area is fine. Yeah, no, just a standard beauty mark, but I am glad that you brought that to my attention. Okay, well, if you would like to return, I wouldn't mind seeing you in 2 to 3 months' time just to re-examine your skin. We can go a little bit in depth. Okay, yeah, this is just the introductory. Exactly, just the very basics of your issues, and if you'd really like to get to the root of the problem. But I do recommend, to be honest, for your acne here, using a topical cream is important, but even more important is just nourishing your body. So chances are you need to get some more fiber into your diet, and you do need to drink a little bit more water. If it's hard drinking water, I do recommend just having an herbal tea throughout the day quite often. Just a plain herbal tea. You don't have to add honey or anything. You could just have it plain just to get some of that water intake in, alright? It's difficult. I have trouble drinking water as well, I know, but I find that my skin is so much better when I do. You'll see those laugh lines just get a little bit more plump, and you don't need to even worry about creams as much. Water is truly, it's life. Yeah. It makes all the difference, but I really did enjoy seeing you today. You're my last patient, so we can both go and relax now, which is wonderful, but I had such a lovely time meeting you, and I do look forward to seeing you again soon. Okay, so take care of yourself, and I have a slip with all the information I talked about, and some more as well, okay? Yes, you can get that slip at the front desk, okay? I'll just fax that over. Okay, take care. Bye-bye.